continuing our strong bipartisan work together. Secretary Kennedy, today we are here to talk about your fiscal year 2026 budget request to Congress. You run a department dedicated to improving the health and well-being of every American. And these programs that you are responsible for administering touch the lives of all Americans at a critical moment in their lives, from research for life-saving cures and treatments for devastating diseases, to maternal health care, to child care, to addressing substance use and mental health. You have repeatedly pledged that you would run the department with, I quote, radical transparency. While this is a great catchphrase, it could not be further from the reality that we're experiencing right now, as we talked about yesterday. As required by law, a few weeks ago, the department sent this committee a plan for how it will be spending appropriated funds this year under the CR. But instead of providing Congress and the American people with any information about how the department is spending tens of billions of taxpayer dollars, there are only asterisks in place of spending levels for over 530 programs.
What's going on, America? This is Conservative Chronicle, and I'm your host, freedom lover, and unapologetic patriot. Today, we're diving into a video that's blowing up all over the internet. It's a hearing clip, and it features none other than Senator Tammy Baldwin absolutely shredding Robert F. Kennedy Jr., or as she refers to him, Secretary Kennedy, over his handling of the Department of Health and Human Services. Now look, let's be crystal clear about one thing. I got plenty of issues with the bloated bureaucracies in Washington, D.C., especially HHS. It's one of the most wasteful, overreaching arms of the federal government. But what we saw in that hearing isn't just a Democrat trying to hold another Democrat accountable. What we saw was infighting in the liberal House, folks. And if you listen closely, it tells you everything you need to know about what's broken in our government.
In no other job under the sun can you essentially leave blank how you are spending billions of dollars. This is flatly unacceptable when we are talking about taxpayer dollars, and the people I represent deserve better. You are undertaking a massive and disruptive overhaul of the department. You are shutting entire offices down and firing thousands of experts. Your plan for all of this that you provided to Congress is little more than one page long. And that shows the chaos that this is creating. I'm assuming today you're going to reiterate talking points about how you are consolidating offices and eliminating duplicative functions. But Secretary Kennedy, this is a genuine request. Please sit down and talk to us in detail about what you are doing. Have your staff talk with our staff on both sides of the political aisle about your plans for the department and what you are doing right now. For a department this important, anything less is simply not acceptable. Let me turn to what it is that we do know about your budget request and what is happening at the Department of Health and Human Services. Your fiscal year 2026 budget to the National Institutes of Health of $18 billion. That would have a devastating impact on research into life-saving cures and treatments for devastating diseases, setting back medical innovations by decades. It would push the brightest scientific minds to work in other countries. It would cede our leadership in biomedical research to China. It would also take away hope from millions of American families. For the family receiving a devastating diagnosis of pediatric cancer, like Charlie and her mom, Emily, who spoke to this committee last month, it would mean less hope. For Jesse, a veteran and a father with ALS, and his son Dewey, who wants his dad to see him graduate from high school, it would mean less hope and less time. This budget says a lot about the priorities of this administration. And normally I could, I guess, disregard it as only a request. But it provides insight into what you're doing right now in fiscal year 2025. At the same time you are submitting this request, you are actively stopping billions of dollars in NIH funding for life-saving research, including on cancer and Alzheimer's disease. You are implementing changes right now that are ripping away hope and life-saving cures from American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate offices is endangering children, including thousands of children in Milwaukee. If you have a proposal to make these programs work better, present it and justify it. Mr. Secretary, you will say that you have to fire thousands of employees and eliminate programs like LIHEAP because our deficit is too large. But you won't mention that at the same time this administration is proposing these cuts, it's proposing tax cuts for billionaires that will add trillions to our debt. You are cutting programs and firing staff with no plan and no understanding of what the department you are leading even does for the American people. And that's why you had to rehire staff working on the World Trade Center health program and screening coal miners for black lung disease. You fired everyone, and now you want to take credit for hiring them back? That's not how this works. Congress provided over $360 million on a bipartisan basis for NIOSH. You eliminated the entire Safe to Sleep program that the Eunice Kennedy Shriver Institute. Safe to Sleep is one of the most successful child safety campaigns in history that prevents 1,500 babies from dying each year, at a time when we are seeing rates of SIDS starting to climb. Without staff, these programs are meaningless, and this is happening across HHS. I could go on and on about how this administration's careless and reckless approach is hurting the people of Wisconsin and this country. These are just a few examples. Mr. Secretary, this committee has worked in a bipartisan manner to improve child care options for working families, address the substance use disorder crisis, support seniors and people with disabilities so that they can live in their communities, and to make the United States the leader in biomedical innovation. You're implementing changes right now that are dismantling our progress, and you're hiding it from Congress and the American people. We don't need to just reject this budget request. We need to reject what's happening at HHS right now. We need to do that before you have caused irreparable harm at the department and the programs it administers that millions of Americans rely on. I yield back.
Thank you. Secretary Kennedy, we welcome.
Right there. Let's talk about that line, you fired everyone, and now you want to take credit for hiring them back. Well, welcome to government logic, ladies and gentlemen. That's exactly how these people operate. Create chaos, burn the house down, then show up with a garden hose and demand applause. Baldwin's losing her mind over an $18 billion cut to the National Institutes of Health, and honestly, good. It's about time somebody started trimming the fat from these agencies. Conservatives have been sounding the alarm for years about unchecked NIH spending, funding for useless projects, and bureaucrats living high on the hog, while real Americans are struggling. Where were these Democrats when Fauci's NIH was spending taxpayer dollars on experiments in Wuhan, or studying the mating habits of fruit flies in Sri Lanka? Give me a break. Now, don't get me wrong, if there's real harm being done to American children, like in Milwaukee's lead crisis, then yes, someone should be held accountable. But here's the thing: Baldwin and her allies built this monster. Decades of government overreach, federal control over local issues, and endless regulations, and now they're surprised it's not working? This is what happens when you centralize everything in Washington. You get dysfunction, you get incompetence, and you get programs being cut with zero oversight because there's no accountability at the top. Oh, and here comes a classic liberal line. You're cutting programs for the poor while giving tax cuts to billionaires. You know what I say to that? Good. If cutting taxes on businesses and job creators helps get this economy moving again, sign me up. I'd rather see hardworking Americans keep more of their paychecks than watch D.C. flush another trillion down the bureaucratic drain. Progress? Is that what you call it? Families can't afford groceries. Drug addiction is rampant. Our healthcare system is a mess, and our border is wide open. That's the progress these people want to protect. I say dismantle it all. Shrink these agencies. Return power to the states. Let local communities take care of their own people instead of relying on Washington to save the day, because Washington never does. Now listen, I'm a father, and when I hear about programs that prevent infant deaths being cut, it does hit home. But here's the deal: if these programs are that important, let's make them transparent. Let's put them in the public eye and let local governments or even private charities manage them. The federal government isn't God. It doesn't need to be in charge of everything. We've got churches, community centers, private foundations, all of them better equipped to serve real needs without drowning in red tape. Look, I don't trust RFK Jr. as far as I can throw him. He talks a good game about freedom and vaccines, but he's still a big government guy at heart. But Baldwin isn't any better. This isn't about fixing the system. This is about maintaining control. That's what every career politician in D.C. is really afraid of, losing their grip on power. My message to Secretary Kennedy: if you're really serious about cleaning house at HHS, do it. But do it with a plan. Work with Congress. Be transparent. And don't pretend you're a hero for hiring back the people you just fired. My message to Senator Baldwin: don't cry foul when your own liberal machine turns on itself. You built this mess, now you're drowning in it. To the American people, stay informed, stay involved, and above all, stay free. We need to cut the waste, reform these agencies, and return power to where it belongs, with the people. Because Washington doesn't fix problems, it creates them. Thanks for watching, Patriots. Smash that like button, subscribe for more hard truths, and drop a comment below. Should HHS be dismantled? Should states take back control? I want to hear from you. Until next time, God bless you, and God bless the United States of America.